So the experience of using the SSI Mantra has been pretty good. It's a robotic surgery platform where we can use the instruments with all 7 degrees of freedom to perform surgeries with complete ease. It's an advanced 3D image system. So the experience has been fantastic and I'm looking forward to doing many more cases. So we did a robotic assisted cholecystectomy today using the SSI Mantra platform. A cholecystectomy is a surgery for removal of the gallbladder. This was traditionally many years back, around 4 or 5 decades back, done with large open incisions as an open surgery. Following that, with the advent of laparoscopy from the 1990s onwards, this procedure has been performed laparoscopically and that has become the gold standard. But now with the advent of robotic surgery and the use of robotic systems for cholecystectomies, I think the gold standard is slowly going to shift from from the laparoscopic to the robotic surgery platform. So what was really valuable to us while performing a cholecystectomy is the advanced visualization that we get with the robotic surgery platform. We can take the camera system very close to the target anatomy, which allows us to depict and delineate even the small vessels to coagulate them and avoid bleeding while operating. The other advantage of the SSI Mantra platform is the open console system. So we don't need to look into a system. Out here we just wear 3D glasses and look straight into the console, which makes it very convenient and comfortable to operate. Three of my most favorite features on the Mantra is the open console design. I think the foot pedal placements is fantastic. It's very easy and ergonomic to use. And the instruments that are being given with the SSI Mantra, the robotic clip applicator, the robotic scissors, and the robotic bipolar, the fenestrated bipolar. I feel by far my favorite instruments. I use them in pretty much every case. I'm very, very comfortable and happy with them. So this system help us, in this particular case, help us overcome many challenges. Primarily being this was a difficult cholecystectomy, which was post ERCP for CBD stones. This patient had undergone an ERCP around 20 to 25 days ago. Entire callous triangle, the cystic duct, cystic artery, the peritoneum was thickened and fused. With the advanced visualization and with the 7 degrees of freedom that we get with the robotic surgery system, we were able to navigate these challenges with ease. So the learning curve for me, I think we did a lot of bench work on the Mantra system. Essentially, the Mantra system is very, very similar to other robotic surgery systems in terms of foot controls and in terms of the basic principles. However, the hand controls were a little different. So with a little bit of bench work, maybe around 6 or 8 hours of bench work and around 3 or 4 procedures is all it took for us to really negotiate the learning curve with the Mantra system. It did take us around 10 to 12 procedures to reduce our docking time. The docking time was initially around 45 minutes to an hour, which came down to less than 10 minutes eventually. People at SS Innovations have been very, very supportive of the entire program out here. They've actually been deputing someone to come in for cases. We had a few challenges early on, which we always had some engineer, some staff from SS Innovations who was always there on site, helping us navigate those challenges and trouble. In terms of training, they've always deployed someone. So if we have someone who wants to train, a new surgeon who wants to train on the platform, there's an endo trainer. The staff is very, very proactive in terms of coming to the hospital, helping us set everything up, training these new surgeons and helping them, kind of kickstart the robotic surgery career. So I've used pretty much all 3 robotic surgery systems that are available very, very rampantly in the market right now. Now, obviously, we have the traditional or the conventional system, which is far superior because it's got 20 years of experience as compared to the other systems. But as compared to the newer systems, I feel Mantra ranks at the top because It is the easiest system to adopt, to use. It is the closest when it comes to the conventional system in terms of foot controls, hand controls, everything. And it's very comfortable to use with the open console design. I would definitely recommend the SSI Mantra system to my colleagues. We've completely shifted our practice from laparoscopy to robotics now. So the Mantra has helped us take this jump very easily without much trouble. So I would definitely recommend. I think it's a fantastic thing that we are getting such advanced technology innovations as a made in India product, and we definitely support such initiatives, and we would like to be a part of such initiatives, and I would recommend all my colleagues to be a part of such an initiative, because it's a matter of pride and honor that we are able to support a completely made in India product.